Now moving on to the next study titled, quote, Topical Dutasteride with Microneedling in the Treatment of Male Androgenetic Alopecia, unquote, authored by Isam A. Nada et al. And this paper was published in January 2018 in the SOHAG Medical Journal. This study aimed to evaluate the efficacy and safety of combining topical dutasteride with microneedling for the treatment of male androgenetic alopecia. So the study included 30 male participants who were diagnosed with this condition. These participants were divided into two groups. One received microneedling with dutasteride, while the other underwent microneedling alone. The study was conducted with the approval of the ethical and research committees at the Faculty of Medicine at SOHAG University. Furthermore, there was a bit of a selection process here, where the study researchers carefully selected its participants, excluding those with other forms of alopecia, systemic or dermatological illnesses causing hair loss, or a history of certain medication and treatments that are used to combat hair loss. So pretty much anyone who's been using minoxidil or finasteride, they couldn't be included in the study. That would tamper with the efficacy results. The average age of the participants was about 26 years of age, and the study spanned a period of 6 months. So again, there were two distinct groups, with one group receiving microneedling, followed by a topical application of 0.02% dutasteride, and the other group receiving only microneedling and nothing else, not even a saline solution or a placebo injection or whatever. They just received microneedling. The treatment consisted of 13 sessions spread over 6 months following specific schedules. The efficacy of the treatment was assessed using various methods, including the Norwood-Hamilton grading scale, photographic trichoscopy evaluation, and hair growth questionnaire for the patient's self-assessment, as well as an investigator assessment using a 7-point rating scale. The study also mentioned safety and tolerability by evaluating local and systemic side effects, as well as hormonal disturbances, specifically measuring serum testosterone and DHT levels. Statistical analysis was conducted using the STATA software, applying different tests according to the data's nature, with a p-value of less than 0.05 considered significant. Now, getting into the results and off with that boring shit that I said in the beginning. The results showed that the group treated with microneedling plus dutasteride experienced a 12% increase in hair density, in contrast to a 4% decrease in the group that only received microneedling. So here, as opposed to the other study that we read before, the study that took place in Mexico, where we saw that the microneedling plus placebo saline group, they did see a bit of growth. Here, we're actually seeing that this group received nothing. They actually lost hair. That is the microneedling group in this particular study. The researchers go on to say that there was a notable increase in the caliber and the terminal to vellus hair ratio in the group treated with the dutasteride plus microneedling. And when it came to patient self-assessment, it also indicated higher satisfaction in the group receiving the combined treatment. However, the study faced several limitations, including its small sample size, which restricts the generalizability of the findings, similar to the Mexico study that I mentioned before. Also, the 6-month duration might not have been enough for long-term results to be displayed. In addition to this matter, the control group's treatment, which involved only microneedling, might have been an adequate comparator to fully assess dutasteride specific effects, and this is my biggest issue with the study. Now, we have to remember that the purpose of the control group is that it allows for the comparison of outcomes in what we are trying to observe by having a sort of measured response. The control group is part of the study that isn't receiving any treatments. Now, in this case, the microneedling control group serves as a partial control. It is debated, right, that microneedling in and of itself can cause hair growth due to the injury of the skin, and when that skin is injured in such a way, it can promote healing and growth factors, which could stimulate hair follicles to grow better. So in this case, having it serve as a control is questionable, and I think a more rigorous control group would have been a placebo group where participants would receive microneedling with a non-active substance instead of dutasteride, or just something like that. Maybe what I'm saying doesn't make sense at all because we want to compare dutasteride microneedling with, I guess, microneedling alone. I think if we had more than one group, like let's say dutasteride microneedling, right? One group, microneedling, and maybe another group using topical dutasteride, another group using microneedling plus a saline solution, whatever. And this criticism also applies to the Mexico study that I was talking before. So yeah, it's a bit of a, it's a hard sell, and I can see people complaining who are major advocates for microneedling because some people do think that microneedling, again, on its own, can cause hair to grow. But it would be another thing if this study actually showed that. The study actually showed that the group that was receiving microneedling actually saw a decrease in hair count. So that's very dissimilar from the previous study we mentioned before, being the Mexico study that talked about dutasteride microneedling versus microneedling plus saline solution, and both groups saw a increase of hair, but it was just that the dutasteride microneedling group saw even more, a significant amount of increase in hair. So I'm only mentioning that part because, yes, I think there's going to be some people who are advocates of microneedling who will insist that, hey, microneedling on its own can cause hair to grow. Now, the study doesn't mention if it was blinded, and in an ideal setup, neither the participants nor the researchers would know who is receiving the active treatment and who is receiving the placebo. So this would be a double-blind study. This helps reduce bias in the self-assessment outcomes, and it can make the reliability of the study much more trustworthy. With that being said, the reliance on subjective assessments like the patient's self-assessment and also the pull test, because with the pull test, essentially they take a clump of hair and they tug at it, quote-unquote, gently. But the thing is, you can't be sure how much force you're applying each time, and you can't keep up with the consistency. So the use of the pull test is kind of subjective, and it's not an adequate way to assess whether or not those hairs are actually shrunk. Because given enough force, you can pull out any hair from any hair follicle, right? So some researchers may be pulling on it a bit hard, others may be pulling on it a bit gently, so it's just not a good marker to determine what hairs have a strong caliber, are actually not in a shedding phase, and are actually going into anagen. So that's not a good marker. I wish they just let that out, to be honest with you. We should ignore that. But with all that being said, the study, in my opinion, does show that topical dutasteride plus microneedling is more efficacious than microneedling in and of itself. But surely it would be great if researchers who are watching this video, because I know some of you exist out there, would be able to produce a more robust and larger study on the matter of dutasteride with microneedling versus microneedling, and maybe versus topical dutasteride, and perhaps as well versing mesotherapy dutasteride. Well, now that I talk about mesotherapy dutasteride, in the next segment, we will be looking at mesotherapy being scalp injections of dutasteride solution and how effective it actually is.